Hi, my name is Tirzah. I'm one of the clinical supervisors here at the Women's Center. Today's video is really just to provide you with a brief synopsis of what to expect here if you do select the Mental Health Women's Center rotation. And so a little bit about me. I started training in 2015. I started training marriage and family therapy with psychology trainees. What's unique about my psychology training program was it introduced me to the practice of family and couple therapy. And so I do have a strong systems approach to how I work with families and individuals because of this. So I do enjoy training, and I have benefited alongside those I train with. I really enjoy the supervision process because of the mutual sharing of our knowledges and expanding our clinical understandings together. And so I'm really excited to share with you what I've learned through working with women veterans in particular. And so what to expect from me as a supervisor. So I've been told by those I have trained with that I am collaborative, flexible, good-natured, and am able to create a safe space to have conversations on how to use your theoretical underpinnings and apply those underpinnings effectively to the life problems of the veterans we serve. So why rotate through the Women's Center Mental Health Clinic? And so, as you may be aware, the Women's Center population is a unique and diverse one. They do present with many life problems shared by civilian counterparts, such as depression, anxiety, relationship issues, trauma, just to name a few. Uh, what you may not know is that the women veterans are really a minority group. Currently, they only consist of 20 to 25% of the military is comprised of women today. And of course, there were smaller numbers of women in the past. Women have filled combat roles beginning in 2013. And so what I have really appreciated in working with women veterans is to see how gender bias, gender discrimination, and combat experiences in the military settings, how that it has impacted women veteran mental health. And so you may be curious, who are you going to work with, kind of what services we provide here. So our mental health staff includes a variety of disciplines, and we work interdisciplinary. So you will have opportunities to shadow psychiatry, social work, counselors, and other psychologists. You will be providing individual and group services to women. So we try to offer a rich and diverse training experience. Your interest is of our priority, meaning we will match cases to ensure your training interests are satisfied. So again, this is a very brief description of what to expect, and I would be happy to answer any further questions as you consider your rotation selections. We are thrilled to have you join our team and look forward to working with you. Feel free to email me, or I actually prefer Teams messaging, so please reach out. Again, my name is Tirzah Shelton, and thank you for watching this video.
Hi, I am Dr. Veronica Lopez Rodriguez. I am one of the clinical psychologists here in the Women's Health Center, and I am also the reproductive mental health psychologist of the team. So I'm going to be providing some information about the women's mental health rotation, specifically the services related to reproductive mental health. The services are fairly new, and they respond to the increasing need of this kind of services for the veteran females population. A bit about me. I have a master's degree in rehabilitation counseling where I mostly work with substance use disorder, domestic violence, prevention of child abuse, serious mental health, and I also work with vocational and occupational counseling, which leads to this interest in professional development. I also completed a PhD in clinical psychology, a postdoctoral fellowship at Bay Pines VA in clinical psychology in PTSD and primary care mental health integration at the Women's Clinic. I did a professional certificate in families and couples therapy, and I am currently completing the recovery from IPV, which stands for Intimate Partner Violence through Strengths and Empowerment, also known as RISE, which is an EBP certification. I did reproductive mental health certification, which gave me a specialized training in this area, and most of my research has been in women's mental health and gynecological conditions such as chronic pain, endometriosis, and how these physical concerns may affect mental health, psychosocial factors, and quality of life. As I said, I have an interest in professional development. I deeply value consultation between psychologists and also with other disciplines. I am bilingual, English, Spanish. I work with Spanish-speaking veterans or those veterans that prefer having services in Spanish. So if that's something the intern is interested in, we can definitely work on it and supervise those cases. More about my services, I primarily identify with ACT. However, I do work with other modalities such as CBT, CPT, PE, COPE, and IPT. I use these modalities for both the general cases and the reproductive mental health cases. When we talk about reproductive mental health services, we consider all of the reproductive life stages: menstrual cycle and emotional regulation, pregnancy, sexual health, intimacy, postpartum, perimenopause, menopause, postmenopause, and everything that can happen in between those transitions. So hopefully the intern has the opportunity to gain experience and knowledge across those reproductive life stages, and they can also participate in the orientations. Every veteran that's interested in either services for reproductive mental health or intimate partner violence, they go through an orientation where we assess the current clinical needs, the goals in a very brief manner. So this is going to be a great training opportunity for the intern, for them to be able to do brief interventions where they can identify needs and also provide recommendation and place consults if needed. They're going to be able to do the consults or the initial intakes. They're going to gain experience in assessing mental health diagnosis, providing diagnostic impression, clinical recommendations, feedback, and also treatment planning with the veteran. Services here for individual psychotherapy are goal-oriented and time-limited for both the reproductive mental health and the IPV-related cases. The services, the length is going to vary both in sessions and the treatment depending on the modality that the veteran chooses. The intern is going to have the opportunity to offer group psychotherapy and facilitate psychoeducational groups. Right now, we have the CBT Menopause group, which is a 10-session virtual group. However, we do have the space for another or an additional group, and the intern has the opportunity to provide their input and also facilitate that other group when created. Seminar and education opportunities, and the intern is definitely going to be consulting and collaborating with other disciplines. I work directly with the reproductive mental health psychiatrist, which is right next door. We share many of the cases, and being able to discuss those cases has been deeply beneficial for the veterans. I work along with the physicians, gynecologists, nursing team, and for those IPV related cases, being able to work with the social workers and the IPV coordinator has been great too. So the intern is going to have the opportunity to learn more about reproductive mental health and IPV, being able to consider those ethical and legal standards or situations that may come up in these cases, which can be very unique. What can you expect in supervision? Lots of support and training. I do not expect you to know about the woman's mental health, reproductive mental health, or IPV. This is the space for you to gain that knowledge, to gain those clinical skills and experience. So if you're interested in having a career in this area, this is the space for you to be able to get trained. You're going to have shadowing experiences. We're going to start seeing or shadowing while I provide the services. Then we're going to be co-facilitating the services, and then I'm going to be doing in vivo supervisions, which means I'm going to be observing you providing the services. Once we both understand that you're ready to be providing services independently, that's something that we will definitely be working on. If needed, we can do role plays or other practical exercises for you to really hone in those clinical skills that maybe you have not been exposed to, specifically those related to reproductive mental health or IPV. I hope we can have great discussions about theory and practical discussions. The intern's clinical perspective and view has a great value here. You come with your own experience and your own clinical orientation. So being able to have those discussions with an open and flexible mindset and work on professional development. You're in a great stage right now, but what comes next? Being able to discuss those next steps is something that we can definitely work on supervision. So thank you for your interest in reproductive mental health services and the rotation that we can offer here. If you have any questions about the services, about the training opportunities, here's my phone number, direct extension, and my email. So feel free to reach out.